Right now I have 3 jobs. So I'm just wrapping up the latter stages of my PhD at Plymouth University, and it's in virtual worlds, and it's a PhD in applied health and human studies. I also work as a casual occupational therapist at the University of Alberta Hospital and Stollery Children's Hospital, primarily inpatient pediatrics, but also outpatient rheumatology and inpatient adult orthopedics. An occupational therapist is an allied health professional that's involved in rehabilitation typically. We work in a variety of settings, both mental health, physical health. You may see us in places like WCB, you'll see us in standalone clinics like this one. Essentially what we're involved with is functional rehabilitation. So what sorts of things do you need to do to go about your day and fulfill your goals? So it's related to physical therapy, but it's not the same thing. I have yet to have a typical day, and I've been doing this for 19 years. It really will depend on which setting I'm working at. So at the hospital, a typical day is usually 8 to 4:15, typically just day shifts. When you come in, there's usually patients waiting to see you. They've either come in, they've had surgery, if you're on an orthopedic unit. If you're working in outpatient rheumatology, they've been pre-booked and they're coming in for a variety of things, either a program assessment or being booked for splints or orthotics or some other type of intervention. At the Stollery, it's kind of all hands on deck because it's a general hospital for children, so it just really depends on who's there and who needs to be seen most desperately. In my clinic setting here, my typical day is I come in, get everything ready, and I've got patients that are pre-booked up to 6 weeks in advance. So I typically know who I'm seeing, but I don't know what I'll be seeing in terms of overall presentation of variety, because most of the people that I've seen have had their surgeries 2 or 3 years ago. Most of them have chronic pain conditions. A lot of them will also have overlapping mental health issues as well. But typically I come in, I see my patients during the day, and later in the week or on the evenings or weekends is when I get all my reporting and charting done. I think it's the variety. I have not had any days yet where I've gone, that was exactly the exact same thing that I did the day before. I think that the flexibility and the creativity, and in terms of the scope of practice, because occupational therapy is so broad, we can work exclusively in mental health. We can work exclusively in very highly specialized things like plastic surgery and see only clients that have had hand surgeries. We can do medical legal assessments like I do here, and again, it's a very big variety in terms of what you see, in terms of the types of injuries, in terms of the types of functional problems, and the different challenges that are posed. It is about 90% women in the profession, but I go into the hospital and I'm making orthotics, I'm making splints, I'm working with rivets, I'm working with leather, I'm working with a cast saw, I'm working with hot plastic, and I go, why are there not more guys doing this? I don't know why, but I think part of it is a lot of them just don't know about the profession in the first place. Some of the popular kind of online stuff that we see, the Anti-Vaxxer Movement is probably the biggest one that, you know, about the body that I would like to see just go away. I think that's probably the number one thing, is in terms of vaccines not working, in terms of the herd immunity not being effective. Having worked with an immunocompromised group of clients, so the people that are on rheumatology are almost all immunocompromised because of the medications that they take. You can see how potentially dangerous it is for them when they're dealing with people who are spreading the flu or other common things. So I think that's probably the number one for me, just because I can see what a great threat that it is to a number of the clients that I work with directly. Well, other than the basics in terms of, you know, studying hard and making sure that you're taking your sciences and things like that, I would actually say that 80% of this job is talking to people. So be social. Sign up for extracurricular activities, get experience with different leisure activities, get experience with people from different walks of life, because that's one of the things that you have to keep in mind, is that if you have no idea what this person's job is, or what their leisure activities are, or what their normal social groups are, or how they worship, or any of those things, that will be a bit of a barrier in terms of you understanding them as a person. And I think that's one of the things that any clinician needs to do, but it's critical to occupational therapy.